Hello, everyone. It's lovely to see some familiar faces there. Welcome to this very timely and important Croakey Live webinar on climate health matters. My name is Melissa Sweet, and I would like to begin with the very important and respectful practice of acknowledgement of country. As someone of colonial ancestry, English, Scottish, and Chinese ancestry, I begin by paying my respects to the traditional owners of this beautiful country from where I'm joining. You can see behind me, Mallee country in southern Lutruwita, Tasmania. I pay my respects to the elders and ancestors of this place, whose multi-dimensional care for country has been practiced over millennia and sets the all-important framing today for these collective discussions. I also acknowledge all First Nations who are touched by this broadcast, all Aboriginal and Torres Strait Islander people joining this meeting, and the wider work of First Nations organisations, communities and people in striving to improve health and well-being across so many spheres and with such care and respect. I honour your work and contributions. As regular readers may know, at Croakey we cover climate and health matters a lot. At the recent Climate Health Matters webinar, our first in this series, Dr. Kate Wiley, who I think may be with us today, asked why we put a strong focus on this topic. My immediate response was, it's the evidence. I've been reading publications in the health, scientific and medical literature for a very long time about why the climate crisis is also a critical health issue. Since last century, since the late 1980s, in fact, when I began as a health journalist, I remember interviewing people like the late Professor Tony McMichael and others. I think of the many articles we have published at Croakey by First Nations authors on the importance of centering care for country and Indigenous knowledges in responding to the climate crisis. We have recently published our analysis of Croakey Health Media activities in 2024. Please have a look if you haven't seen it already. It's on the website under our impact page. Shows that we published 195 articles on climate and health matters during that year. By contrast, the silence on climate and health matters during this federal election campaign has been striking. This is despite evidence cited by initiatives such as the Global Covering Climate Now collaboration, showing that the majority of the world's population support climate action and that they get the need for urgency. This webinar will inform related journalism by Croakey editor and journalist Mari McInerney. So please don't hesitate to put your own thoughts and comments into the chat so that Mari can take your thoughts into her story. Our thanks at Croakey to the local and independent news association, LENA, for a grant enabling a series of 2 webinars on climate and health matters in the run-up to the federal election this Saturday. If you haven't already seen, LENA is backing a sector-wide fundraising campaign this week. It is especially timely for Croakey as our financial situation is currently precarious and we are reaching out for support. I acknowledge our co-chairs, Professor Bronwyn Fredericks, who's currently overseas, and James Blackwell, and our immediate past chair, Professor Megan Williams. I'm very grateful now to hand you over to one of our directors, Alison Verhoeven, who will bring her extensive experience in the health sector to moderating this discussion. Thank you so much, Alison, and I look forward to hearing from you all.
Thanks, Melissa, and hello, everybody. I'm joining you tonight from Ngunnawal country, otherwise known as the Canberra Bubble, and I'm really delighted to be here for this very important topic, which, as Melissa said, has not had enough coverage in the lead up to this election, but we're addressing that tonight. And importantly, some of this work will be highlighted in the election newsletters, which are coming out in the next few days, one later tonight, I think. I'm delighted to welcome our panel and thank you all for sharing your time and your experience and your commitment at this very, very busy time. I know you're all busy advocating for the work that you're doing for the various organisations you come from. So tonight we're going to hear from Michelle Isles, who's Chief Executive Officer at the Climate and Health Alliance, also from Dr. Jo Adams, who's a Research Fellow at the Violet Vines Marshman Centre for Rural Health Research at Trobe Rural Health School, Trobe University in Bendigo, and Dr. Karen Anderson, who's Senior Health Promotion and Public Health Advisor at Women's Health Loddon, Mallee. I'm going to start a little bit informally rather than going through the sort of normal CVs that are presented at the starts of webinars like this, by asking each of our speakers to tell us in a quick grab, 1 or 2 minutes each, why they're working in climate health space and what motivates them to do so. So, Michelle, could I start with you, please?
Thanks, Alison, and hi all. Great to be with you. Look, I started working in local government 20 years ago. So working with community being the heart of the purpose of, that level of governance. And I was working on sustainability and climate change, and it became apparent pretty quickly that, as we were looking at the impacts and the evidence coming through around floods and drought and extreme heat, that people were at the centre of that and their health and well-being. And so that sort of started my journey in thinking about how I might respond to safeguard health. And with many experiences in between. But during COVID, I was general manager of a hospital. So there was already a lot of stress on a regional health system. But there was also storms and floods and fires in the broader region that health system and our community had to respond to. And in regional communities, our health workers are our community. It's all interconnected. And so I saw the pressure of health leaders being on the front line and, the need to work with multiple sectors and multiple people across community on the solutions. And so that's why I've jumped into climate and health more specifically here at CAHA.
Thank you so much, Michelle, and thank you for your leadership of that important organisation. Jo, how about you? What motivates you?
Well, hello, everyone, and thank you, Alison. Yes, I'm joining from Dja Dja Wurrung country, so I'd like to acknowledge that. My background is in public health, and so I obviously take a population health perspective on many things. And my PhD focused on the importance of contact with nature and the health and wellbeing of older people. For me, it was a natural fit to move across to climate change and the impact that it has had and will continue to have on the health of everyone. I feel very passionate about rural health and recognise that there is a disproportionate impact on people in rural areas that relates to climate change and to health more generally.
Thanks very much, John. We look forward to hearing from you a little bit later in the session. Before we continue, Karen, would you like to tell us what motivates you and why you are involved in this work?
Yeah, thanks, Alison. And like Jo, I'm also coming from Dja Dja Wurrung country and also come from a background in public health. And in fact, Jo and I actually studied together many, many years ago. So my background is in academia. So I've spent over 20 years as an academic in public health and certainly understood that inextricable link between humans and their environment. And when I joined Women's Health Loddon Mallee nearly 2 years ago, the Women's Health Services in Victoria had just introduced a new portfolio, a strategic priority area of women in a changing society. So looking at that intersection between gender, health and climate change and disasters. And we had some funding to do some work in the flood recovery space. And from there, once I started hearing women's stories and I've got my own lived experience of climate-related disasters, it has just sort of fueled this passion to continue working in this space and advocating for that gender lens in terms of climate change and disasters.
Thank you, Karen. I'll look forward to hearing more about your research a little bit later in the session. I'm going to revert back to Michelle now and ask you, Michelle, if you could please set the scene for this discussion on regional communities and climate health, what your overall assessment is about how well communities across Australia are equipped and prepared to deal with the health impacts of climate change.
Thank you, Alison. We're tackling the big questions early on.
Getting into it straight up.
This learned community. Well, I think we're all aware, and we'll hear more about specific examples soon and evidence soon, that regional and rural communities are disproportionately affected by climate change. And we only need to look at the events of this year, whether it's drought across South Australia and Western Victoria, extreme floods and impacts in northern New South Wales, how many floods can Lismore endure, and indeed Queensland. And that is impacting, of course, livelihoods, health and wellbeing. To the question of how well equipped communities are, I mean, I like to take a strength-based approach to regional communities as a regional community member, but we also know the evidence shows that there are systemic issues, lack of resourcing, funding and health challenges in regional and rural communities, notwithstanding the efforts of some people around this virtual table. And so climate change, we know, is a threat multiplier, so is exacerbating some of these existing stresses. And so I think that communities, as was mentioned in the introduction, are well aware of climate impacts, both through evidence over many years and if, in fact, mobilise some of the first, climate emergency groups and sustainability groups came out of regional communities in Australia in response to the stark evidence about what was happening to our planet, but also through this lived experience, seeing scarcity and seeing the impacts, wanting change. So I think when we look at resilience, there is strong social capital, there is connection and willingness and desire to create change. And yet political capital and the ability to secure some of the resourcing that's needed, is definitely a challenge. I'm really looking forward to hearing about some of the diverse voices tonight. But I think there is more that we can do to elevate the voices of people in regional communities. In urban environments, they don't tend to be heard. Even in my circles, I've been talking about some of the stresses in regional communities, and they're not hitting the main paper. Thankfully, we have independent journalism to tell these stories, but we're not hearing them enough. Or if we do, it's a grab. The Rural Health Alliance and CAHA, a member of CAHA, put out a media release, and we had radio stations wanting the grab, but not to hear the detailed stories. And I think that's what we need to really inform and resource and effort and response. I'll pause for a moment.
Michelle, you raised a really important point about the gap between the social capital and the willingness to change, and yet the lack of political capital, if you like, in this space. How do you think we can tackle this? We know that the mainstream media are not grabbing these stories and running with them in depth. They're just taking the little grabs. How do we actually encourage a deeper thinking around analysis from our political leaders in communities?
Yeah, it's a great question. I mean, we obviously have an election happening this Saturday, so this has been the time to raise our voices, and we have seen a strong emergence of independence and movements again led out of regions in Australia. So that is one way to be heard. Advocacy or collective action, supported by health, by community leaders. We have a role because health is an equity issue, and we have a role in supporting communities to speak up and to make sure that they are heard. I think political capital is related to financial capital, and that's where we're seeing those stresses. So certainly federal and state and territory politicians, hold some of the purse strings. But I think there's a role for all of us actually to support the stories being told. And I think in the more nuanced way, if we go to the election, we are seeing commitments around health, which are, terrific. We've seen a $20 billion commitment to a Rural Australia Future Fund. Great, from the opposition. Climate is not being mentioned at all. We've seen terrific policy around, 9 out of 10 GP visits, bulk billed, great. A 24-hour phone line. Where is climate change in all of this? Because we know that it is pressuring regional communities and the health systems that they depend on. And so we actually need dedicated training and dedicated resourcing for health. And I think if we can talk to those needs and opportunities through the channels we have available, then we'll alleviate some of the other concerns and stresses that regional communities face.
Michelle, do you think perhaps framing climate change as a cost of living, part of the cost of living crisis, possibly as a way forward? I mean, I've clearly heard the insurance industry trying to advocate for changes to support for insurers through climate change. Is there a way we can connect climate change, health, and the cost of living focus that so many political leaders, independents, coalition, Labor are trying to talk about this election?
Absolutely. On so many levels. So one thing I haven't mentioned, we've talked about climate change, but not the cause. And many regional communities are sacrificed by having to live in close proximity to fossil fuel extraction, be it coal and gas. And we know there's a huge evidence base around the health impacts, but that's not modelled or considered when we look at even emissions reductions nationally. So we need to already look at the health impacts that communities are experiencing. Then when we add climate change, well, we've had some unfortunate examples where we now know health impacts. I was just looking at the bushfire, the Australian Black Summer from 2019 to 20. There's now been an estimated cost of 1.95 billion from smoke-related, the PM2.5 from those bushfires. So we have some of that evidence. We need to translate that into what that costs community, chronic illness, the response from the health system to be able to serve and provide care is absolutely needed, and something that CAHA would be grateful to join with some of the learned people on this call to get over the line.
Thank you, Michelle, and I can see some comments coming in about that in the chat, and I'll revert to them a little bit later in the session. For now, I want to pass over to Jo. Jo, both you and Karen work in the Loddon Mallee region, but I'm asking you first. So would you mind to give us a little bit of a sense of the place in which you're working? What's your community like? And particularly, with the lens of climate and health.
Thanks for the question. Yeah, the Loddon Mallee region is rather large. It extends from the Macedon Ranges down in the south up to Mildura in the north. So it is quite a big area. It includes 10 local government areas and at least 12 First Nations groups in the Loddon Mallee area. And they have quite a range of resource, those local government areas, and people's incomes in those areas vary greatly as well. So you can imagine that population density varies. Also, the climate is quite variable across from the south to the north, and so there's a great range in the area, and some low socioeconomic population groups, and some of the health issues obviously vary as well. I think listening to Michelle speaking, there's one of the things that is a prominent issue in the Loddon Mallee region is the high rates of skin cancer in comparison to other areas. So there are some very different health issues depending on access to resources and health services, but there are some that are the same. So quite diverse.
Thank you, Jo. And how do you engage your community in the research that you're doing? Tell us a bit more about your research and the people you're partnering with.
Okay, well, the research that I was going to talk about today came about through a collaborative agreement between ourselves and the Loddon Mallee Public Health Unit. So the Loddon Mallee Public Health Unit obviously have a big role within the Loddon Mallee region, particularly in health promotion and health surveillance. But often don't have the resourcing to be able to do the research. So hence a collaborative arrangement between ourselves at La Trobe University and the Public Health Unit. So that was what initiated the study that we've been doing. And I think when we started off looking at the climate health, climate change and health, that's a big priority area for the Public Health Unit. We looked at the National Health and Climate Strategy and could see that it identifies priority population groups, and that includes older people, people from culturally and linguistically diverse backgrounds, but also people living with disabilities. And the strategy also acknowledges that people living in rural areas are more disadvantaged. So we wanted to understand a little bit more about how those groups are impacted and how those population groups are impacted. Because obviously, if you belong to a priority population group and you also live in a rural area, then that is going to exacerbate that status as being vulnerable to the impacts of climate change. So we engaged with population groups in 3 different areas. So in Bendigo, we spoke with population groups that were young and neurodiverse, and in excuse me, in the middle of the Loddon Mallee region, we spoke to older people in the township of Charlton, and in the north, we spoke to multicultural groups in the town of Robinvale. And so that gave us a good spread throughout the region, a lot of different issues that they were talking about. But it was interesting to see that there were some common concerns for each of those groups, and there were some things that were different. But the common concerns, I think, speak to a lot of the problems that Michelle's raising as far as engaging with rural communities. And one of the big ones was mistrust of information, particularly from local media and from just the whole range of information that's thrown at us about climate change. People in a lot of rural areas don't know what to believe, and they don't know where that puts them. They hear a lot of the catastrophic information on a global scale, but how that then relates to them on a local scale is difficult for them to bridge that gap. And I think some of the language that's used is difficult for people to take on board. It also perhaps assumes that people in rural areas do believe that climate change is anthropogenic and that it is human caused. So there's some people within that community groups that aren't quite sure whether that is the case. I think the health impacts from that we saw was allergy and asthma was one, skin cancer was another, exposure to heat, mosquitoes, but the most prominent was mental health and anxiety. People are feeling anxious about climate change and about the impact that it's going to have on them. And sometimes that anxiety leads to them disengaging from the whole debate because they don't feel there's anything they can do. They feel a sense of powerlessness about what can I do that will make a difference. So some of the concerns that did come out were sustainability, the viability of their townships. Can they continue doing the agricultural practices that they are with a changing climate? Another one that was perhaps closer to home was housing efficiency and power security. How does that leave them if they can't keep warm in their house in the winter or they can't cool it in the summer? It's they're big issues. So cost of living was an issue, but I think it's more a sense of powerlessness that a lot of people felt in engaging in the debate. Some of the differences were obviously population characteristics, occupation, socioeconomic status, education, but also sensory perception for neurodiverse people. Access and use of technology and information was another one, plus age-based perspectives and the levels of experience that you've had with extreme weather events makes a difference in how people respond. So that was what we tried to capture in talking about and understanding the perceptions of rural people and their experiences and their thoughts about health impacts. You really do have to scratch the surface a little bit to make the link sometimes between what the health impact is, because people, it's not always front and centre in their lives.
Thanks, Jo, for letting us have some insight into what your findings are from your research. You mentioned the personal experience that people have in rural communities, and I know Karen, our next speaker, has had particularly personal experiences around the 2022 floods. Karen, can you tell us a little bit about that and how that's affected you both personally but also your work.
Yeah, thanks, Alison. So as I mentioned, I live in Bendigo, and a few hundred metres right behind where I'm sitting tonight is the Bendigo Creek. And so in 2022 with the floods, my backyard actually flooded. So I've lived through floods, I've lived through bushfires, I've lived through drought. I grew up in a very small rural town, but hadn't experienced anything quite like this. Just the intensity in which the rain fell and how rapid it was. It just came in under my outdoor alfresco area, right up to my back door within minutes. My husband and I were scrambling, trying to divert water. Thankfully, we were able to move outdoor furniture and create a bit of a diversion, and that water was able to clear away before it actually got into our house. And from there, we knew that there was more rain coming, and so we were able to secure sandbags. We now keep a supplies in our shed, ready for the next event, because we know that it's inevitable. But I think the biggest impact for me has been seeing the impact on my daughter, who's only 8 years old, and the anxiety that that has created for her, even to this day. So we had rain on the weekend, and immediately raced for her headphones and sat on the couch going, "Are we going to flood? I feel like we're going to flood, Mum. The rain's come, it's really hard, it's really loud, we're going to flood." And so every time she now sees clouds coming in, is it going to rain? How much rain? And so we have to actually look up how much rain. Okay, well, how many millimetres is that, and what does that look like? And how quickly will it come, Mum? And so it's that at 8 years old, that anxiety is already there. And my fear is, what does that then do for her as her understanding around climate change continues to grow? And that story, my story is, I sat in the focus groups that I did with women across our region and heard stories from women just like that. Their children who were anxious, the inevitability that this is going to happen again and going to continue to happen again. I heard stories of, women sitting on flood watch. Every time it rains, we're on flood watch. So, the mental health impacts on our children and on women are very real. And in terms of my work, I joined Women's Health Loddon, Mallee in the May of 2023, so not that long after the floods. And the Women Rising project that I've been involved in was the first project that I actually worked on for the organisation, and it's been a real turning point, I guess, in my career, and has led me to this focus on gender and climate change and disasters.
Thanks, Karen. You've mentioned the Women Rising project. Can you tell us a little bit more about that? What does it involve? What work are you doing in that space?
Yeah, so Women Rising, the project itself stemmed from the recognition of the exacerbation of gender inequalities during the floods. And we recognise that from the evidence that women are disproportionately impacted by climate change and disasters. And we hear about that in terms of rural people, but it is also in terms of there are gender elements of this. And so the evidence shows us that, women are more likely to experience violence in times of disasters. There's increased risks of stress, financial insecurity, there's the disruption to their personal and their family lives, and then there's the flow-on effects to their physical health, their social well-being, their financial security, etc. And so the Women's Health Services in the regions in Victoria that were impacted by the 2022 floods received funding from the Victorian Department of Families, Fairness and Housing to lead some work in that flood recovery space, bringing that intersectional gender lens to the work. And so we were able, with that funding, to really tailor a response that met the needs of our communities. And so our aim with Women Rising was to apply an intersectional feminist lens to floods and to centre the mental wellbeing of women, and to ensure that women weren't overlooked in the disaster recovery efforts. And so we really wanted to provide a targeted approach that addressed the unique needs of women within our region. We wanted to advocate and centre women's voices in climate and emergency discussions. And we wanted to provide space for women to be able to tell their stories, for their voices to be able to be heard, to really understand what those localised gendered impacts of disasters were, and to be able to use that to build a strengths-based approach to disaster recoveries. And so we developed a number of project activities that really put safe hands around women. We wanted to, at all stages, ensure that women were safe, respected, valued, and that we didn't do further harm to them. And so we had a number of key strategies. So the first being funding for community-led recovery activities. So we allocated $90,000 in quick response funding for community-led activities. So we funded 19 projects across our region, and those were a really diverse range of projects. We had activities that promoted women's leadership. We had activities that fostered community connection. We had nature-based activities, art-based. They were really diverse, and those projects reached over 1,000 community members across the Loddon Mallee region. The next strategy that we implemented was the facilitation of training opportunities. So through our engagement with local governments, and particularly flood recovery officers, really highlighted to us the need for gender transformative training and policy frameworks in this space. And so this then led to a strategic partnership with Gender and Disaster Australia, where we were able to roll out their lessons in disaster training to people working in local government, first responders, community members across the region, and the staff in Women's Health Loddon Mallee. And from there, 3 of us, including myself, are now accredited to be able to deliver that in an ongoing capacity across our region. The next piece that we did was our Nurture and Nourishment on Country weekends. So this is special work that we've done with First Nations women's leaders. We've currently held 2 of these weekends where we bring First Nation women leaders together and really just provide a culturally safe space for those women to really come together, to connect, to support one another, to nurture and to nourish them, and for them to nurture and nourish each other in recognition of the enormous load that they are carrying within their communities. And then the final piece of Women Rising, which was the main piece that I was involved in, were our focus groups. So we ran 5 focus groups across 5 local government areas in our region. And these were really instrumental in understanding women's lived experiences of the floods. And the women in those focus groups ranged in age from in their early 20s right through to their mid-80s. And that piece of work has enabled us to develop a model that centres women's wellbeing and empowerment in flood recovery. And we're currently in the process of finalising a theory of change to further guide our work in this space as well.
Thank you so much, Karen. And I think what's really resonating to me, listening to both Karen and Jo speak, is the opportunities and the capacity you've had to be able to translate research into practice, which is truly transformative for particular groups in your region. Michelle, I'm wondering whether you might be able to reflect on what you can learn from both the research that Jo's described and the practical initiatives that Karen's described for CAHA's advocacy in this space.
Thanks, Alison. Well, gosh, extraordinary work and insights. And some of you may have had a chance to read the articles produced by both Dr. Karen and Jo, but there's more that I want to continue to learn after this conversation. It's clear that specific, place-based understandings are needed, both in terms of climate impacts, and we heard from Jo around those, very specific climate impacts like sunburn, the exposure that's unique in the region, to then thinking about, the experience of women in their diversity and love the nurturing and nourishment, putting and holding First Nations women is something that at Kaha, we centre in terms of equity and justice, but also thinking about that experience and what resilience looks like. I was really interested to hear about the trust and perception, and we all know there's so much disinformation out there, and yet this curated and co-designed work to really understand and bring together people builds trust and relationship, to understand both the impacts, but to make them some of the solutions practical. And today we ran a workshop with health leaders around the co-benefits of some of the solutions. But really, people spent most of the time yarning to understand their story and values before they could get to that conversation around what's next. And I think that's what we've heard in a very nuanced and sophisticated way from our speakers. So knowing that we've got national frameworks and strategies, we've got national challenges, but having these community-led bottom-up approaches to understand research and to build models up, I think is the way forward, particularly with climate adaptation. It needs to be locally led and then shared more broadly for broader application.
Thank you very much, Michelle. Well, I'm now going to put all three of you on the spot, and with a very quick question. We've got a couple of days until the media blackout hits us and we don't have to listen to the election headlines, at least for 24 or 48 hours, I'm not sure which. So we've got a few days. You've got a wish, you're a genie in a bottle. You've got one wish. What headline would you like to see? What announcement would you like to see in the news on climate and health in the next couple of days? And Jo, I'm going to throw to you.
Very difficult to come up with a very clean, encapsulated statement, but I think it would have to contain words about collaboration and listening to diverse groups and understanding impacts from a place-based position. So, yeah, can't give you a clean swoop.
I love the words collaboration and listening. Thank you, Jo. Karen, what about you?
Yeah, I mean, I sat here today thinking about this and going, oh, there's so many. I probably got two. So the first one would be, I think, women-led climate initiatives receive record funding to enhance community resilience.
Very good.
And the other one, which I'm a bit like Jo, I can't quite form it into a nice sentence, but I'd actually like to see something that recognises that one of the biggest threats to women's health and safety in times of climate-related disasters is gender-based violence. And so I'd like to see more, particularly in that primary prevention space.
Thank you. And Michelle?
Shall I say the National Health and Climate Strategy is funded? No, I think on the basis and what we've learned today is very much that it's communities win climate and health outcomes. That communities are recognised for the role they're playing, having advocated and got together in collective action around these matters.
And while I've got you on the spot there, Michelle, another question for you. What is one key thing that you think which would make it easier for you, your work, to address climate health concerns? And what are the barriers to that happening? You've mentioned the strategy and you'd like to see that funded, but is there something else that would actually make the work of Kaha more feasible or more viable?
I think some of it is let's keep doing what we're doing, in that let's keep telling the stories, because stories have impact. And tonight I've heard these amazing visual images and hard stories that I could now understand and take forward. That's what I'll tell other people about the stories I've heard tonight. But I think it's also something we picked up on earlier. Let's work together to cost the impacts on health from both fossil fuels and climate change. It sounds straightforward, but we haven't landed it yet, and we need to do it to get on the agenda, to be the first thing that politicians say and the first things that other media outlets report.
Thanks, Michelle. Well, that leads very nicely to Jo, our academic on the panel tonight. Jo, what do you think would make a difference? How would you be able to do your work better and more positively? What do you need?
A lot of it is about addressing that mistrusted information. So communicating things in a way that are clear and simple and have meaning in everyday sense to rural people. And I think that's really important, to be clear about what it is that we're trying to achieve. And the language that we often use is not really acceptable to some rural people, like even just the term climate change. It rolls off our tongues, but it's not something that they would readily relate to. And often you have to use other wording like extreme weather events or something different that is not so assumptive about what's going on. So I think it's about clear messaging, and that really comes back to then partnering with rural communities, understanding what their perceptions are and really relating to that more closely.
Thanks, Jo. Karen, in your experience working directly with rural communities and small groups of people, are those barriers there in your practical experience? And if so, what needs to be done about them?
Yeah, I was thinking about this question today, and I think that one of the barriers that we're really facing in terms of women's health is actually the lack of sex and gender disaggregated data. That we don't have, there are massive gaps in data when it comes to women's health and wellbeing. And so, I think that there's a real opportunity for researchers and those that are working in this space to help close that gap so that we can actually work with communities to develop evidence-based programs, place-based programs, and capture those stories. And I think one of the things I'd like to see is an investment in that research, because there's certainly a place for us in that, in terms of understanding what the barriers are for communities and particularly for women. And, that opportunity, I think it's come back to the point that Michelle was talking about earlier, is that telling stories, capturing the stories and telling people's stories can actually resonate with politicians and policymakers, which is partly why, we set out with Women Rising, is to capture women's lived experience and their stories, to understand those barriers, but also to recognise their strengths.
Thank you, Karen. Now, in the chat, I've seen a few interesting comments. A couple from Kaz, and Kaz, I'm wondering if I could put you on the spot. I can't actually see you with my screen here, so I hope you're still there. Yes, I can see you now. Kaz, you made some comments in the chat about working with people with disability, in particular, and some of the comments around the types of language that are used and what you found actually resonates with the people that you work with. Would you like to perhaps share that with the group more widely?
Thanks, Alison. And sorry, my internet's not brilliant, so I'm just going to wander somewhere where it might be a bit better. But look, I haven't done extensive work with disability communities. We're really just trying to begin to engage with them around climate change and health awareness raising, and also some energy literacy and energy efficiency sort of workshops. But just the conversation so far, I'm realizing we need to build our capacity to be able to engage appropriately and understand how to, that inclusive engagement. And I think really, so it's a two-way journey. We're building capacity at the same time and building our ability to be more socially equitable in our practice, but also building capacity of those communities that identify with disabilities, that they are understanding the impacts of climate change on their health, and especially because they are, as we've said before, the impacts of climate change on health amplifies the systemic disadvantage they're experiencing. So Yeah, I think there's some clear messages from their communities around how we communicate, but also how we understand how to be more inclusive in our practice and how we live.
Thank you so much, Kaz. Appreciate your thoughts there, and sorry to put you on the spot. I'm
No,
going
that's
to
fine.
I'm going to
That's good.
I'm going to put another victim on the spot now, and that's Simon. Simon made some comments, Simon, about cost of living not being cost of living issue, but more about a business viability issue, and some comments about the political determinants. Would you like to reflect a little bit more to the group?
Yeah, I think so. I work up in Echuca. I live in Melbourne, work in Echuca, and I'm honestly, I've been paying attention a lot to local politics down here, not a lot to up there. But I've noticed recently, looking a little bit more into it, that there really isn't in that area. There's no political conversation about climate. There's nothing about mitigation. There's nothing about renewables. And I've been in touch with the local member up there, who's a National Party member, and asking him his views on climate change and risk mitigation. And they're still towing the party line of, well, we don't want to use valuable agricultural land to waste on renewable energies. And sort of, I think, failing to understand that this isn't about wasting valuable agricultural land. This is about preserving valuable agricultural land and preventing ongoing risk. So I think there's definitely there seems to be a lack of understanding, and they're still backing in nuclear power, which the way this is looking is not going to be around for another 35 years. So the concern is that any valuable agricultural land they're trying to look after will be completely decimated in the next 15 and 20 years, and we get hotter and hotter and less rain. And I don't think there's really a conversation with community about how this is going to impact their livelihoods. I think a lot of communities, rural communities, are struggling from the Echuca floods and the Bendigo floods. They're recovering from that, but I don't think there's lots of conversations about what's going to happen this year. So far this year, for example, we've had, I think, temperatures up to 3 degrees every month hotter than the long-term averages. There's no rain. We had 20 millimetres of rain a couple of nights ago. Up until that point, there'd been hardly any rain. So. But nobody's really talking in the community about how we're going to prepare the community for that. So, there's obviously the health risk, but the other risk is their livelihoods. They need climate stability to be able to farm, and at the way things are looking at the moment, over the next 5 to 10 years, they're not going to have any of that stability, and I don't think anybody's really having that conversation with them about how to prepare to that. So it's really. As I said, climate change is a bit like, Voldemort. It shall not be mentioned. And that's what's sort of happening in the political debate at the moment. Nobody's talking about it, and we're not preparing our regional communities for the impacts that are going to come. Well, they're with us now, and that's just going to get worse and worse over the next 5 to 10 years.
Thanks, Simon. Look, that relates very well to an experience I had many years ago when I first started working in health advocacy, health leadership organisations, and somebody said to me, "Oh, there's no point in talking to the health department. Go and talk to Treasury. They're the ones that actually make the health policy decisions here." But yeah, so very relevant. What you've just said relates very well to another comment I've seen in the chat from Sarah Charlton. And Sarah, again, I can't see you on my screen, but I'm wondering whether you might like to turn your microphone on and say a little bit more about why you think comfort care only is not good enough for the planet.
Yes, I've managed to turn off my microphone. Turn on, rather. Yeah, I've been thinking about this a lot recently. There was an article by, I've forgotten his name, but an Irish palliative care clinician who's now in America, about this idea that we're, thinking about the planet as someone with a terminal illness and how we would manage that. And I got a lot of comfort out of the article, but it still doesn't seem good enough. Like we need to do absolutely everything we possibly can, and people don't realise. So I'm getting emotional just talking about it, but people don't realise that we are literally pouring fuel on the fire, and it just doesn't seem good enough.
Thank you, Sarah, for your very heartfelt commitment to this work, and we really appreciate the work you're doing. Thank you. We've got another Croakey board director online, and that's Dr. Rebecca Ivers. And again, I can't see you either, Rebecca, but I'm wondering whether you might like to, hi, I'm wondering whether you might like to reflect on what you've heard tonight and what that might mean for researchers and people who are you're working with in public health faculty around the sorts of work that they might commit to and frame going forward as a result of the types of conversations we've had tonight.
Yeah, really, really good. It's been a great discussion. Thank you, everyone. A couple of things. Well, one is it just literally popped up on my email over the weekend. I mean, you might be aware of the Columbia Malman climate change responders course that's just run in the Western Pacific, which was run earlier this year, which has been the last few months, which has been fantastic. But we've got another curricula which is being developed by the Global Network of Academic Public Health Institutions. So I'm chair of CAFIA, which is the Australian peak body, which represents all universities that teach public health degrees. GNAF is the global one, so it's all the peak bodies globally in this one. And they're developing up a curricula, which is how to teach academics how to teach about climate change and health, which I think is going to be really important. So it's going to be made freely available to public health academics to learn how to teach about this with a curriculum and so on. So I think those kind of things are really good because it's actually, you're basically giving people the information that they need. They don't need to go, I don't know how to do this. You're saying, well, actually, here's the curricula, go and teach it, find some local experts, you can take it on, makes the process much easier. So I think, seeing these kind of things pop up is really good. For research, I think actually one of the things that might be really worthwhile thinking about is, and, for researchers and going to, I think for people, for activists and others, and us, all of us, is lobbying NH and MRC and MRFF and actually asking people to actually consider climate. So in the same way that we might consider First Peoples and have, really strategic conversations about how our research is addressing, the needs of everyone in the community, you might actually try and actually have criteria around climate change as well. So making sure that, things are sustainable, building sustainability I'm not quite sure how you would enact that, but I think actually starting to actually have it as a consideration. So if we're spending money, how is this not worsening climate change? So it's something to think about for research. Certainly more climate change opportunities. In terms of research, climate change and health, and actually having strategic grant opportunities for that, I think is really important. But there's some things that sort of have come to my mind. But I mean, the other thing is as well, just noting that we're all pretty, I won't say old on this call, but we're certainly none of us are in our teens and 20s, as far as I can see from the cameras. And I think actually it's young people that are also really passionate and actually we're co-designing public health strategies, but actually working with young people much better, and actually even for research, actually co-design with young people in advocacy, I think is going to be really, really important because, much more passionate. We can even see in the way people are voting and communicating this election that young people, they're very cynical about, the two major parties, and they are saying, no, this is bullshit, why you're not addressing our needs. And I think that's coming out clearly. So actually trying to actually work out how we can actually motivate, how we can build on that, I think is going to be really important.
Thank you so much, Rebecca. Look, I can see a challenge here straight away for Marie McInerney as she's putting together this story. We need a TikTok version, Marie. So there's a challenge for you, and maybe we might engage with some more young people about that. Look, thank you very much, everybody, tonight, everybody on the panel, but also Croakey in particular for hosting this, Lena for their support for this, and thank you all for engaging so actively in the conversation. I just want to highlight a couple of things that I think were calls for action out of the discussion we've had tonight. First is that we need to think about a way to talk about this in terms of financial terms. So business impact, financial impact, how do we frame this so it has relevance to the people who count money? Secondly, how do we address misinformation, disinformation, and Joe, you raised that. And look, this is partly, I guess, why Lena is supporting organisations like Croakey to do this work, because we are all concerned about misinformation and how we can actually make a difference in that space. So any suggestions you have to us going forward would be really helpful in that space. And look, lastly, really about how do we talk to different groups of people? How do we talk to young people? How do we engage people with disability? How do we think about this in terms of women's perspective, small rural communities? And of course, we haven't talked very much tonight, but in particular about the impact on First Nations communities. How do we engage them and empower them and support them to lead their own responses and initiatives, so that this is actually genuinely, from a community up approach. So those are key takeaways I've had from tonight, and I'm looking forward to seeing how Mari's going to translate that into the forthcoming Croakey article, but also on TikTok. So there you go, Mari, over to you. Melissa, is there anything you would like to say before we finish off tonight?
No, I just really like to thank everyone. It's always so great to hear from the panel, and that was a really helpful discussion. And I also really appreciate everyone putting comments in the chat, because for us at Croakey, it's all about pushing the conversation forward, looking for how we can usefully contribute in our reporting and other activities. I really love the idea of working with organisations or individuals to try and get some grants to do some of the on-the-ground reporting. We do actually have a proposal at Croakey to do some reporting on local communities' health issues. So, very happy to talk to any organisations that might be interested in engaging with that or supporting it in some way. Very much take the youth comment on board, and, as people have commented, we are all getting to a certain age at Croakey, and we really are keen to do succession planning and longer term sustainability, and to develop ways to make it more sustainable for young people. We recently had actually the son of one of our contributors come forward, who wants to help us in translating our content to make it more accessible and useful for younger audiences. So we'll pursue that. But if any of you have young people in your networks who might like to engage with that, thanks, Joe, for that comment. I agree. Diverse groups of young people. We're always very open to suggestions and collaboration. We are a shoestring operation. We do as much as we can on not a lot, but we're always happy if someone wants to reach out to us and do a project together. It's always about being responsive and making things happen. So, don't hesitate to do that.
Thanks so much, Melissa. And look, thank you to everybody who's taken part tonight. Melissa did mention that Croakey runs on a shoestring. It is very much running on a shoestring. We are currently undergoing a funding drive, looking to shore up some support for Croakey so that we can continue the good work that Croakey is doing. And I can see in the chat that some people have already commented around supporting and engaging with us, which is really fabulous. But if you're able to encourage those that you work with to perhaps take an interest in Croakey, and particularly to help us support our work, in whatever way possible, whether it's just subscribing, whether it's sharing stories, whether it's actually contributing funds or purchasing advertising or engaging us to support conferences. We are deeply, deeply grateful for any support that you might give us. So thank you very much. Thank you to everybody on the panel, and thanks to all the team who've helped put this together, Mitchell and Melissa and Mari, and it's really great. Thank you very much. It's been a great discussion.